also protecting us and preventing cardiovascular disease, so that's strokes, heart disease, and also preventing diabetes. It is really important for our mental health. There's lots of literature out there about that in terms of it helping reduce symptoms of depression and anxiety. And it helps with our brain health as well. So we know that people that are more active have better memory, they're able to have quicker mental processing, and so this overall improves our overall well-being. The reason I talk about adults here at a paediatric day is that we are really hoping that all of our kids that go through transplant are going to go on and live really long and healthy and active lives. And so it is really important that we're starting to get physical activity embedded in that lifestyle into the future. The other thing, just to be mindful, I know that transplant just turns families' lives on their heads, and as parents, your routines and your exercise also go out the window. And so this is a bit of a reminder that it's really important that you look after yourself as well, and that we start introducing physical activity back into your life if you're not already doing it. We know that children who are more physically active have better fitness, they have stronger bones, they have better mental health, they have reduced body fat, they have better cardiometabolic health, so that's their lungs, their hearts and their muscles, and so they're the things that are going to protect them against that heart disease and diabetes into the future. And better motor and cognitive development, because they're getting more opportunities to move and to interact with their world. Just quickly, I've popped a link in your resources for the next two slides. These are the 24-hour movement guidelines for Australians, and they're broken down into different age groups. The main thing I just want to put out there is that for children from the ages of 1 to 5 years old, they should be aiming to engage in 180 minutes of physical activity every day. And some of that includes energetic play. And for 2 to 5-year-olds, we should be aiming for less than an hour of sedentary screen time. So that's not looking at the screen and dancing and interacting, but time where they're just sitting and passively watching a screen. For children under the age of 2, the recommendation is for no screen time at all. I put this up here not as this is what you should be doing right now, because I realise in the context of transplant, this is pretty unachievable. But I'm putting this here as a goal for what we're trying to get to as close to as possible into the future. For our 5 to 17-year-olds, we're aiming for 60 minutes of physical activity, which also includes some vigorous activity and things that are going to help to build bones multiple times a week. And it's less than 2 hours of recreational screen time, so this is not including time that is spent dedicated to schoolwork. So now moving on to transplant, we know that it has a really big physical effect on our bodies. Being in isolation, being really unwell, you end up being less active. And this leads to a decline in physical function, so we lose strength, we lose fitness. This flows over to have an impact on our mental health. And because we can't do all the things that we want to do and interact with the people that are important to us, it has an impact on our quality of life. We see changes in body composition, so we see bones becoming weaker, we see loss of muscle mass, and increased body fat. Through the loss of opportunities to move, particularly in the children that are going through transplants when they're in those really developmental years where they're acquiring new skills, we see the potential for developmental delays, that we're having to do some targeted intervention around that. Through drugs that you have, often we see peripheral neuropathies, which can impact sensation and strength in your hands and your feet, and this has a flow over in terms of fine motor and gross motor skills, balance, and then of course fatigue, which is really a big one that a lot of our patients report and is really well acknowledged in the literature. And this really has an impact on what you can do in your day-to-day life, and it has a big impact on your quality of life. From a physio perspective, I just want to flag a couple of things that I'm particularly concerned about. So probably the biggest one is the bone health. So we know that there's various factors that are contributing to lower bone health in patients that have transplant. So that is that you're less active, so your bones are not getting forces put through them to give the message that they need to build bone and stay nice and strong. We know that nutrition So the building blocks of the bones often is not there, and so that is another factor that's contributing. Plus then all the medications, a lot of them will have an impact on how the bones are forming and absorbing and that side of things. The other thing to be aware of, so when bone density is low, you are at increased risk of fracture, and this often in our patients actually presents more as stress fractures, so pain in feet and weight-bearing bones that's niggling and it's just not going away. The other thing just to be aware of is a term called avascular necrosis, where certain drugs can impact the blood flow within the bones, and so you end up with little areas of bones that their structure is not as strong as other areas. The great news is for kids having transplant, they are still building bones. So we build our bones up until our mid-20s. So even though you have had a transplant and your bony growth or building might have plateaued or even dropped off, we still have a lot of time to be able to try and get right up to that peak bone mass in our mid-20s. So we need to be doing things to make sure that we are building bones in these years. The other thing just to flag from so for those people that have had graft versus host disease, particularly with the skin, sometimes the skin GVH can also flow over into connective tissues around joints, and so it's really important that we are moving our joints through full ranges, particularly the shoulders, I find, and making sure that we're not getting stiff. So we're keeping the range in through those joints. And if you're noticing problems, then making sure that you're flagging that with your team. And then also, our lungs need to be exercised. We've got ribs that need to move, we've got muscles that need to move. If we're not consciously doing things that make ourselves puff and move those joints through their full ranges, then they can get stiff as well. And there's an overlay that GBH can play a role in that as well. Sometimes we actually need to do targeted pulmonary rehab where we're actually exercising your lungs. We know from the literature that kids that are more physically active following transplant have more muscle, they are fitter, and they are less tired. Sometimes it is hard to say which came first, the chicken or the egg, so I acknowledge that. But our goal is to try and move more. If you are stronger and fitter and less tired, you're going to be able to do more in your life. This is going to mean that you're going to do more things that are important to you, and so your quality of life is going to be better. This means that you're able to go back to school, you're able to do things socially. That is really important for those connections. That seems to be a bit of a theme that we've got running through today. And of course, then it's got the mental health benefits as well, so reduced anxiety. There's a lot on this slide. I've popped this in here as a resource for you moving forward because I don't have enough time to be able to talk to all of this. But just to highlight, preparation is almost as important as getting stuck in. If you rush ahead and you do too much, often then you're having to backpedal and reset. So taking the time to actually prepare and think about what your physical activity is going to look like is really important. A couple of things that I really want to highlight is the importance of nutrition. If you do not have energy to spare, so on top of what your body just needs to function on a day-to-day basis, you are not going to be able to increase your physical activity. Instead, when you're physically active, your body is going to be taking resources from itself, and so it's going to be counterproductive. So we need to make sure that nutrition is really spot on alongside what you're doing in terms of physical activity. The other thing is just trying to see if you can do it as a family-based approach. If you are out and you are active as a family, it is something that probably all of you are going to enjoy more and you're going to be more invested in, and that this is something that you're going to continue doing into the future. Key is finding something that you enjoy and that makes you happy and embedding that as part of your lifestyle moving forward. It doesn't need to be going to the gym or doing a specific exercise program. This is about just getting you moving. The other thing just to acknowledge is that going through a transplant is like running a marathon, and you've just finished this marathon and then you're looking at the next marathon that you're having to do to actually get yourself back to where you want to be. I think so much of what Shannon has spoken about really ties into this, that you need to make sure that you're in the right headspace to be able to move forward. Give yourself that time, do the things that you need to do to make sure that you're in the right space to be able to commit. You don't have to rush into being physically active. It is really important to acknowledge that you need some time. So, to finish up, I guess the more practical side of things of how does this actually look? So, as a starting point, just try and incorporate any sort of extra movement into your day and into your life. Start really small. If you go too big, it is probably going to feel overwhelming and unachievable. So just start by increasing your incidental activity and social engagement, or it might be going to school. That is a lot compared to being stuck in a room and not able to do anything. It's really great if we can start looking at things that are looking at posture and alignment and balance. These are really important for our function. They don't take huge amounts of energy as a starting point. And it gives us a really great foundation upon which we're then going to build into the future. Like Shannon mentioned, those mind-body practices are really great from a mental health point of view, but also just helping with that mind-body connection. Your body is going to feel different moving forward to what it did pre-transplant, and so it's learning about how your body feels and how it moves and how it's responding. So this is talking about things like mindfulness and relaxation, but it might also be stretching or Pilates or yoga. So they're a really nice place to start. Then we move into more specific training. All the literature involves a strength component and a fitness component at least 3 times a week. So this is more your specific targeted exercise program. Once we've done the strengthening and the fitness so that you can control your joints and you've got the fitness to support it, then we start working more on your agility and power and speed and coordination and working on those really specific skills. Few things that I really want to highlight that is super important in your journey getting back to being active is that if there is pain, we must pay attention to it. Do not push through this pain because we know that it could be a fracture, or there's biomechanical factors, so you've lost some muscle, body alignment has changed, which can predispose you to getting sort of these overuse injuries, which are really tricky to then pull back once they're there. So really pay attention to musculoskeletal pain and address it. With being concerned about efficiency, it is really important as you start to introduce things with impact that we do this slowly and gradually, so that we're sort of testing the bones out without jumping in and doing too much all at once and then having to deal with a fracture, which is a significant setback. Likewise, it needs to be a gradual build-up in terms of what you're doing in terms of intensity, duration, frequency, so that we're not going too hard too early, because often what we find is that people end up in this boom or bust cycle where we feel really great one day, we go crazy because suddenly we're actually feeling good, and then the next day we fall in a bit of a heap. What ends up happening is we sort of see a bit of this cycling that sees a downward trend. So we're crashing out, coming back up, crashing out, coming back up, but you can see that there's a gradual trend downwards. What we are actually wanting to achieve, especially if fatigue is a big factor, is that we have a baseline level of activity that you can do day in, day out, whether it's a good day or a bad day. Once we've got this baseline that you can do every single day, on most days, then we start ramping it up. So we will increase by 10% for a week. If that becomes too much, instead of crashing out and going back down to the bottom level, we just go back to the previous level. Until then we feel ready to step that back up again. And what we hope is that we have a stepwise approach so that gradually we are building how much we can do every single day. Just to finish, again, these are resources that you will have in a pack. There is so much out there, a lot of it thanks to COVID. So there are services and resources that are available to help. There's specific programs that you can get involved with. There's heaps of apps and online programs that are about trying to get kids moving, and these are just a few, but there's a whole lot more out there. There's a lot of community clubs and programs out there as well that are really open to having kids involved that may have some sort of a disability. I haven't contacted them all specific to transplant, but these are a really great starting point to call and have a conversation because they're all about inclusivity. And just for more information, there's a couple of
Senior dietitian. She'll speak to you more Cyril Nigel because she's been running the transplant this long time. You can tell us about strawberries and eating nicely.
Thank you for talking about nutrition so much. I think that's it, really, isn't it? So I just want to put a disclaimer in. I'm sorry about the hospital food, the nasal tubes. I really am. And imagine if today I lit up a cigarette right now before I do this talk. Imagine how you'd feel. How do you feel? Is there any gasps? I'm getting a no from Frank. Gasp. All right. So there's usually like, imagine if I was doing that now. Now, if I pulled out a Snickers bar, what would you think? Like,
Share.
Salivate. Share.
Give me one of those.
So, I'm not here to be the diet police, that's for sure, but I want to talk to you about good stuff without it being that you have to eat like a saint. But I also want to place junk food and chocolate and things like that in a category of, if you were to eat them that much, they're as bad for you as cigarettes. But I want you to eat them in their place, so a little bit would be fine. And even if you smoked one cigarette a day, that wouldn't be bad for your health, probably be great for your decreasing anxiety levels. So, okay, I'm sorry about the neutropenic diet, the low bacteria diet, but there is some good news on that front. Now it's called the sterile, the immunocompromised diet, the low microbial, the low bacteria, we call it PCH, the clean, we used to call it a PMH, and the pregnancy diet. And I know that at Fiona Stanley they're getting a form that says, and men are given it, you will follow the pregnancy diet lifelong. So it's fraught with difficulties. And what are we really saying is that, are we saying that all of our food is actually dirty if you're not following this special diet? So the clean diet, or the neutropenic diet we'll refer to it as, was adopted as a hypothesised method to prevent infection and infection-related illness in transplant patients. And the theory is and was that if bacteria in the gut were reduced from eating less of it, then the risk of bacterial translocation, so bacteria going into the blood from the gut, and bloodstream infections would also be reduced. Now we're a lot better than in the 1960s when you would have got a huge dose of antibiotics and a huge dose of castor oil and everything would have been sterile. But we've come a long way, and recently even more. So now we've looked at to be or not to be the low bacteria diet. So the general concept of the diet makes sense in theory. However, there is no scientific evidence that infection rates are reduced. So that's good news. Despite a lack of clinical data, the neutropenic diet remains a common recommendation around Australia, around the world, amongst all of us, but we're all doing it a bit differently, and that's why it's often called the pregnancy diet, because people don't quite know what to do, because there is no such diet. So it was time to have a really good look at this, and this has been partly because we've listened to the families about how bad it all is, and our patients, and there's been increased interest by families and physicians in nutrition and its impact on on the health, and also quality of life. There's also substantial improvements in supportive care and other anti-infection strategies, including the safety of the food we provide, and the emerging data on the role of the gut microbiome in health and disease and quality of life. Basically, there's also a lack of evidence to support its use. And we know PCH, we're very cautious and try and be very safe. So the neutropenic versus a food safety-based diet. So the evidence is strong for adopting a food safety-based diet. Now, a lot of randomised trials have shown that restrictive diets like the low bacteria diet are not superior in preventing infections, and that the maintenance of a diverse gut microbiome is even more important. So what clinically sound strategies are best? Now we know you've been through transplant, sorry about that diet. The ones that are coming through again, you're not going to have to follow it, so that's the good news. But we didn't do anything wrong. It was safe, so that's good. But I do want to undo the association with the fear of feeding children the wrong food, or the fear of eating something that might make you sick, and try and create a more positive association with nutrition and food. So we're going to go with the food safety based diet. It's a little bit stricter while you admit it, but not really, having said that. And this is for the whole family, so not just for our patients. We want everyone to follow it, including myself. So when we talk about food safety, there's lots of information on the internet. It's about cleaning, washing hands and surfaces, so we all want to do that as a family. It's about separating food, so you don't want to bring home your raw meat and put it next to your cooked steak and let them cross over. It's about cooking it to proper temperatures. That's really important. You don't have to get a thermometer, but just try and get it steaming hot and cook it. Don't escape that, but don't kill it so it doesn't taste good anymore. Often what we do wrong with meat, sorry kiddies, we'll kill the meat and then we expect them to chew it and eat it. But if we gave them something quality, they'd quite like the red meat. Chill it, refrigerate it promptly. So when you go shopping, do get your freezer bag in the car and quickly put it in the fridge. Don't leave it on the counter. Safe food storage, and all of the hospitals, for example, follow very strict food safety guidelines. So what we're providing is safe. So now, some of you and most of you will have received this glossy booklet. In your handout, in your bags, there is the QR code, so you can link into that. Maybe going to change the title a bit, but this is a book everyone's given at diagnosis, and this is based on food safety principles. And in it, we won't go through that now, but it's really about avoiding high risk, but it doesn't mean you can't have it. There's nothing you really can't have. I'll explain that a little bit more. Other than we do really want you to decrease, especially during treatment or when you're neutropenic, but after that, and for all of us, we do want you to avoid high risk foods and choose lower risk foods. There's questions time after, but it's usually around eggs, raw eggs and cold meats. We don't want you to have raw eggs, but they don't have to be cooked to death either, and it's mainly on the shell that's the problem. So if you're putting your eggs in a bowl and bits of shell drop out, then we want you to discard that and start that again. But if they're cooked, even a bit soft cooked, that's fine. And cold meat, we don't want you going to deli counters, buying your ham, but I know people really liked a pizza or wanted some cold meats. So if you cook it in a toasted sandwich, or get the pre-packaged one and open that, and special patients get the first few slices and the rest of the family can use the rest. So we also have a magnet, which is 4 steps to food safety, which you can put on your fridge, or there's QR codes. But again, there's lots of information on the net, but this separates it quite easily. And then there's our videos, if you wanted to look back at those. So there's the Australian Guide to Healthy Eating. I would really encourage you to watch this area, which is the grains, and I think there's a lot of wheat and gluten intolerance, so you might find that you want to follow a more gluten wheat-free diet here, so more rice-based potatoes, so please do that if your gut's sensitive. And again, dairy is another one, so not too much milk, but yogurt is good. And then we really want a balance of everything. The gut microbiome is where it's at for everyone. Bacteria and other microbes in your gut help you digest food, so you'll tolerate food better, and support your immune system, your heart, your brain, and so many benefits with body weight and mental health. They've found if they get a fat rat and a skinny rat, if they take the gut microbiome out of the fat rat and put it in the skinny rat, without changing their diet or exercise, the skinny rat gets fat. And vice versa. There is something called crapsules, which is about fecal stool transfer, which we're not going to do, but that's how far it's come and how important the gut microbiome is. The body is full of trillions of bacteria, virus and fungi, and that's called the microbiome. And some bacteria are associated with disease, and others are extremely beneficial. And there's gut dysbiosis is what a lot of us have, and especially our patients. And that's when there's a balance of the bad bacteria being higher than the good bacteria. And how do we resolve that or restore it? So something you eat can induce a change in that balance within 24 hours. So if you eat a heap of sugar, you've already changed that balance. So it's quite important without scaring you. Our transplant patients are at risk of developing a loss of gut microbiome diversity and a shift into a higher bad bacteria component. So it's really important to restore the gut microbiome. We want to do that by avoiding processed foods, not like the plague. You can have your Snickers bar, but not every day, not all day, not a Snickers bar and some ice cream and some jelly and soft drink. It's all going to multiply. Avoid a high sugar diet. Sugar is not great, but I really don't want you to use artificial sweeteners on the flip side of that. Eat a high fibre diet. Fibre is like an intestinal broom. It'll sweep everything out. It'll normalise your stool, and there is a daily requirement for fibre. Well-balanced diets. Include pre and probiotic foods. There's lots of information on the net around that. The ones we know are yogurt and kefir. Include garlic and fermented foods. And way after transplant, you can consider a pre or probiotic concept. At the moment, through transplant, definitely no probiotic powders, no Yakult little drinks. Don't anyone have them? They're full of sugar, not very beneficial. But there's definitely some like kefir you can have, and some other supplements that do have a little low grade in them, but they're not studied enough really. Optimising body weight's a thing as well. And the way to do that, again, eating healthy diet, exercise, as we said, be label reading, concentrate on decreasing your sugar, watch your snacks aren't too frequently not nutritious. They can be less nutritional value when they're a snack. Drink fluid, especially after today, a few more tears, lots of water, watch the soft drinks and the juice. Avoid the artificial sweeteners, and I've mentioned good fats twice because we need good fats: avocado, nuts and seeds, MCT oil, etc. We've talked about the rest of that, but what we really want to say is we want to improve the relationship with your food as a family. It's probably gone from very fear-driven, you've got to put on weight, you've got to eat this, don't eat that, but we want you to enjoy coming together as a family and eating a variety of foods. And put your fruit into dessert, that's fine. The two main things I want you to include is apples, because they're very good for the gut, and yogurt, because that's also good for the microbiome. Thank you.
Are patients a long way out?
Yes.
Because we have a few that are a long way out.
Yes.
I wonder what they're like.
Close. Pretty much.
Thank you for that, that's lovely. Full disclosure to staff, the low bacteria diet is going and we're catching you up with it. So Josette's been presenting it, so you're going to hear more about it soon. Because that's kind of come out now. Kerry Graham, clinical nurse specialist for survivorship, is going to speak to us a little bit about when you kind of leave the transplant team and move into survivorship, where really the focus is forward. Thanks, Kerry.
So, survivorship, we as a team encompass everybody that's gone through the oncology and haematology service for either a cancer diagnosis unit, and transplants included in that. It's also some non-cancer diagnoses that end up with having transplant therapy or other therapies that require for them to go on and live a long and happy life. So basically survivorship begins at diagnosis, and the known probability of development of late effects needs to have active intervention, and we need to make sure that we are looking at these kids and making sure that their late effects don't become fixed or unmodifiable, and we need to make sure that we are ahead of the game and educating and doing what we need to do. So entry to survivorship is by medical referral, and that's usually at 5 years from end of treatment. So kids go through their surveillance period after they've had all the treatment. They then come to us, and the focus changes somewhat from being unwell, having cancer or having had a transplant, to their rest of life and just monitoring and dealing with the things that they might have developed. So the core responsibilities of our survivorship service is active management of existing issues, so things that we know that these kids have already developed because of their disease or treatment, having appropriate surveillance for their known potential issues, so a lot of kids will have potential issues that we know about. They may not have them develop, but we know that we need to make sure that we watch for those. Effective handover of their medical responsibility to the survivor, so as they get older and they become adults, they need to actually be able to be responsible for their own health and their own follow-up and their ongoing life stuff. So we then make sure we need to have a proper equitable transition process for all patients, so that's regardless of whether they've hit the arbitrary 5 years of end of treatment stage, or if they had their treatment and their diagnosis at an older age and they need to move out of paediatric services before that 5-year stage, then we're always very happy to see them as well. The information is available on the Children's Oncology website, and that's at the bottom there, so I put that on all of the patient treatment summaries and give that to the GPs and the families as well. So, a little bit amazingly, it's something like 95% of children, this is from a St Jude's study that was done not so long ago, are likely to have some form of late effective treatment, and a third of those can have life-threatening or chronic side effects from their disease or treatment process. So that's a little bit confronting, but I also want to acknowledge the fact that not all of these children who receive transplants have been diagnosed with cancer. So there's a number of kids that have received transplants for non-malignant positions, and things like Fanconi anemia, Hurler syndrome, SCIDS, and other things that for them to be able to go on and survive and grow up, they need to have a transplant. So these kids need to also have continued surveillance, as their conditioning treatment usually involves high-dose chemotherapy and sometimes a form of radiotherapy. So we have stratification of all of our survivorship clinics. So there's the 2 types of transplants there. We've got all the different categories of kids that come through survivorship, but the transplant ones are the autologous transplants, the kids that have had their own stem cells, and so that's considered a high-risk solid or an auto transplant clinic. So we try to have about 5 to 6 patients per clinic in those, because they do need to have a lot of surveillance and there's a lot of education and discussion that needs to be had. So there's quite a lot of children that we have in our service that are put into those high-risk clinics. So we have about 6 or 7 clinics a year, and these are the categories of the children that have had greater than or equal to 250 milligrams per metre squared of anthracycline, which is like the doxorubicin, daunorubicin, mitoxantrone, which is what they'll receive for transplant, or greater than or equal to 5 grams per metre squared of cyclophosphamide equivalent. And then also children that have received radiotherapy, which can affect their heart, or also TBI, that's for their whole body stuff. So also the allogeneic transplants, we have 5 to 6 patients per clinic, because they are quite intensive. These kids have had a lot of treatment, and there's 5 clinics per year where we try and put all of these kids into the same clinic. So usually they're at least post 2 years out from transplant, usually closer to 5, because they do stay in the transplant service for quite a bit for their surveillance, and usually the kids that have got no active GVHD come to us. The other kids tend to stay with the transplant team. So we have, and that's at the transplant team discretion, I might add. So transition of follow-up for these kids too. We also have dedicated transition clinics. We have 4 patients per clinic, sometimes 5, and there's 10 clinics a year. So these are the children that have aged out from paediatric follow-up, and they're usually about 18 years of age, or they've reached the end of secondary school. And we're no longer able to see them in our paediatric service, so they need to transition out to adults follow-up. So there can be quite a lot of late effects from transplant therapy and other cancer diagnosis and treatment, and they can affect lots of different systems in the body. So everybody else has talked a lot about psychosocial and psychological health. A lot of our kids have psychological disturbance post-treatment for their cancer or their transplant. They often have some neurocognitive impairment because they've missed a lot of school, they've had treatments that can affect their neurocognitive development, their memory, their processing. They have, a lot of our kids have endocrine dysfunction, so they'll end up with seeing the endocrinology service as well as us. So different types of chemotherapy and radiotherapy can affect their metabolic function, their pituitary dysfunction if they've had radiotherapy to their brain, their thyroid function, their sex hormones, their puberty and their growth, and so there's a lot of things that can be impacted by treating these kids. They can have visual disturbance or impairment, they can have hearing loss or hearing impairment, they can have cardiac dysfunction, which can become quite serious. they have, especially the transplant kids, they can have a lot of dental problems and end up with a lot of interaction with our dental department and having extractions, having all sorts of dental treatments done. Dermatological stuff, so they need to have skin checks every year. They need to make sure that they're aware of different changes in their skin and have things followed up if they notice changes. Pulmonary changes, particularly the kids that have had things like total body irradiation or busulfan and different other things that can affect their lungs. Gastrointestinal changes, so we have our lovely dietitian involved with these children that need to have some dietary support. And second, malignancies, which can be another quite serious and difficult thing for people to manage, with particularly their secondary AML is probably the most common thing that will happen. They can get secondary CNS tumours, breast cancers for kids that have had radiotherapy to the chest, skin cancers, secondary sarcomas and colorectal cancer. So that's why it's so important to follow these kids up properly. So we have multiple different services that can be involved with their follow-up, lots of different specialty areas that they might attend, lots of different clinics when they come to see us. Surveillance will be determined by the treatment that they receive, their known late effects of treatment and the potential late effects of treatment. And the frequency of the particular surveillance is determined by cumulative doses of certain chemotherapy agents, so particularly things like anthracyclines. If they've had high dose anthracyclines, they should have 2 yearly cardiac echoes as an example. And also radiotherapy, total body irradiation. Talking really fast. Sorry. So common requirements for surveillance is so that these children should always have an annual physical examination, including measurement of their height and their weight. Just their general observations, their pubertal assessment, neuro examination, cardiorespiratory examination, eye exam, skin exam, necessary blood tests. They don't have to have blood tests every time they see us, but they do need to have the blood tests that are required. Respiratory function for kids that are at risk and have some respiratory things going on already. Echocardiography, 2 to 5 years. Thyroid palpation, thyroid function, thyroid ultrasound, particularly the children that have had transplants, thyroid function is really important. Relevant imaging, MRI, ultrasound, and referral to appropriate specialties for further assessment of specific conditions that can arise. Transition, mostly is to the care of their GP or for GP coordination of care plus other tertiary follow-up as required. Fiona Stanley Hospital transplant team are the people that we send our transplant patients to, and they will look after them lifelong for their transplant follow-up, and that's unfortunately the only dedicated transition pathway that we have these days. So that's a little bit tricky for some of the kids. And whew, that was a lot.
Thanks, Kerry, all of us speakers. We are just running a bit tight for time. That doesn't mean that we don't have the opportunity for you to catch up with all of our professionals if there are specific things. And I think the important thing with Kerry's is she's covering all transplants and very cognitive of the fact that people have had transplants for different reasons, and some of that might have appeared a bit confronting, but it does relate to the drugs that the patients have received during that time and perhaps before they even come into the transplant.
Thanks, Fiona. Hi everyone, my name's Jesper. I'm the Program Manager for Onc and Heme. I'm just here today to introduce our community partners who some of you have already met in the foyer. We've also got Arrow Foundation, who couldn't be here today but have kindly been able to join in online, and I'm just trying to load them up through Teams. In the Teams now. Hi, Jana. Johnny, can you hear me? Johnny, can you hear me?
Can you hear us? Let me look at that volume.
Can anyone hear me?
Yeah, hi Johnny, we can hear you. Can you hear us?
Jasper, you want to change the microphone and put them back?
Okay.
IT person,
Thanks,
go for
Sam.
it.
So, yeah.
You can play song. Right, straight in there. Be quiet, please.
We've all been there.
I'm gonna dial into my phone so that she can just. Hi Jenna.
Hi, Jenna. Hello. Having some technical difficulties. Sure, no problems. Hi everyone, my name is Jana. I'm the Programs Officer here at Arrow. Arrow exists, we're a nationwide organisation called Arrow, the Bone Marrow Transplant Foundation. So we assist patients all over the country. Our mission is to improve the quality of life for all people needing bone marrow and stem cell transplants. We do this by providing financial assistance and information to patients, their families and carers. We also support the education and professional development needs of nurses and other healthcare professionals working in the transplant field. And we're also investing in medical research that improves bone marrow and transplant patient outcomes. So to kick off, firstly, our financial support is available during the first sort of 12 months of your transplant. We help cover the costs such as petrol, groceries, household bills, accommodation and other expenses that might be worrying you during this time. If you need any of this type of assistance, you can speak to your social worker or your nurse coordinator, and we can organise a referral to Arrow. Next off, we have our patient information guides. These are our guides for auto, allogeneic and paediatric transplants. They're available online. They're probably most beneficial during that time, like leading up to your transplant. And you can find more information about that on our website. Next off, transplant tribe, or we've got the podcast, Straight Marrow podcast. Arrow supported this production of the second season of the Straight Marrow podcast. The podcast is a wonderful resource. It discusses all things allogeneic bone marrow transplant, from pre-transplant considerations to survivorship, and it is told by experienced healthcare providers, patients and carers. I have to just stress that this is a really amazing project that we're really excited to be a part of. I hear time and time again from many patients that sort of let us know that it's really beneficial to listen to, because just listening to doctors and health professionals talk about bone marrow transplant sort of in a way that they can understand a lot easier. So we've had some really good feedback from this. So I would recommend going and having a listen to it. You can find it on our website, or you can listen to it through your Apple or Spotify apps. It's all available online there. In addition to our much needed financial support, we've also focused our efforts this year on how we can support patients and their carers emotionally with access to information resources, particularly for those patients that are more than 1 year on from transplant. So this has resulted in the launch of 2 new patient programs during the year, Transplant Talk Live and Transplant Tribe. Transplant Talk Live is an online webinar series involving healthcare professionals presenting on topics including returning to work, study, and long-term self-care after transplant, as well as patients sharing their transplant experiences. So this is one of our new resources that we've launched. We've had over 230 people registered, and nearly all the participants have enjoyed the webinars and would definitely recommend it to others. Our second new program this year is Transplant Tribe. It's a peer support group for bone marrow and stem cell transplant patients and their carers. We meet once a month online, and that's nationally, so anyone can join from all over the country. And this forum provides an excellent opportunity for those who have received a transplant and want to share their stories and provide emotional support to those who are at different stages of their treatment. So that's, yeah, we meet up once a month with that, and it's just a really good way to sort of share your experiences in a sort of safe environment that everyone's comfortable with. So that's been a really successful resource as well. And you can find out all information on what we provide at Arrow at www.arrow.org.au, and you can find all the information there, or you can contact us at info@arrow.org.au. So thank you everyone for listening.
Thanks, Jana. Does anyone have any questions that I can type in? Well, I've got that.
The brochures for the Arrow is all in your goodie bag. So they've sent us some brochures with courier it, so you have all that link to your goodie bag. Yeah.
Okay, well, we'll say goodbye and we'll catch up soon. Okay. Alright, next up we have the Kids Cancer Support Group. Richard, Janelle, welcome. I'll bring up your slides if you like. Or do you?
Hey everyone, how you going? My name's Richard. A lot of you in here I know do know me, some don't, but I'm the president of the Kids Cancer Support Group. Kids Cancer Support Group was an organisation set up over 40 years ago by parents for parents, basically to be on that journey with you through whatever oncology or haematology journey that our families find themselves on. So from the outset, I will let you know we have no difference between haematology or oncology. You receive exactly the same support. Okay. So what we do we'll meet you on the ward usually. A lot of you will have seen toys, food in fridges, that kind of thing from us. Pizzas, which I'm feeling a little bit. I think there'd be more overall than the oncologist food for that, but what we do on the ward is the tip of the iceberg. There's a lot of things here that I believe some of the oncologists don't even know that we support and provide now. So there is a lot that after the journey through the ward you come and we are available for a lot of things. So because it was set up by parents for parents, we have all been there, we've all been on the journey. All the committees in the constitution are actually parents that have been on the ward, okay? And that's something that's not going to change. So we understand exactly what you're dealing with, where you have been and where you're going through now, okay? So we're available, we respect your privacy. That's one of the most important things. We don't shout about a lot of things. A lot of things on social media you see is that on-ward support, maybe the pizzas, the toys, that kind of thing, but there's a heck of a lot that goes on in the background that we do for families, and we respect your privacy with that, so it's not always advertised, but it is there. Here, today, and ongoing, you'll probably find there's a lot that you didn't know is available to you. We're not going to just throw all this support at you as well. It's a bit of mutual empowerment. It's there, you guide it, it's as and when you need it, and there's no time limits as well. A lot of people have, for their reasons, time limits. Once you become part of the KCSG community, it's all the way through, from diagnosis, treatment and beyond. There is no time limit, okay? So what we do have is a hospital to home program. We have 6 to 8 weeks worth of support, but that's just a guide. It can be as long or short as you guys need, and also when you need it. It might not be as soon as you come out from the ward. You might want to get home, breathe, get back to your families, and just stay away from a lot of things for a while, even, you know, because you just want to get home and get away from the ward. But what we do have is qualified peer support professionals. Not only having lived experience, they have actually, a couple of our members gone through courses, year-long courses to become qualified peer supports. So they can give you the guidance, give you the help, but in a trauma-informed, professional manner. We'll also, that peer navigation, so if it's not broke, don't fix, or if someone else is actually doing a support, we'll also help along with social work you to find those other supports. If someone else is providing it, there's no need for us to do it. So we'll just guide you in the way you might need to find some other things that you're not aware of, okay? And it will be tailored practical support. What one family needs or requires might be completely different to another family. So it's on a needs basis of what you need at the time, okay? So it's, what we say is, if you're unsure, just ask, and we'll probably most likely make it happen for you anyway, okay? And again, discreet, confidential, and trauma-informed support. All right. Not only is it peer support, it's also the practical support. The foundations of the Kids Cancer Support Group is built on that practical and peer support. Okay. Like I say, 40 years it's been going, and we've got the honour of being at the committee at the moment, and I'm sure down the line it'll be passed on to the next lot. But that involves things like fuel vouchers. I know when we were in transplant and in the ward, the mileage soon clocked up on the cars because you're in and out, swapping one parent in, one out, looking after the siblings. So it doesn't take long for those expenses to go up, so please ask your social work or come direct to us. Either way, we'll help you with that. Essential home maintenance we'll do. Anything really that you need there. Obviously going home after transplant, it's important, you know, you're worried about the immune compromised kids. So we'll do deep clean carpets, grouts, air conditioning units, anything like that. Just give us a shout and we'll do that for you. Garden maintenance, anything like that you need. You're in the ward for a long time, so you know gardens are going to be the last thing on your mind. But let us know, we'll get someone in to do that. On a bigger scale, as you see, I don't know if you've seen Charlie, the telethon child at the moment. Yeah, she was someone we referred to them and has become the telethon child this year. But we have a great connection with a new organisation called Build Now. They're doing some wonderful work. If you saw, Charlie received a kitchen in our outdoor area. So if there's something for your child that might need, put a smile on their face, help you guys practically, give us a shout, and we're an official pathway or referral to the Build Now Foundation. Connection for the community, for support from others who actually get it. So like I say, not only the committee and most of the volunteers, families that are coming back to help us do what we do. We also have online support, so as well as the KCSG Connect pages, you can actually drill down further to chats with other parents about bone marrow transplant. If it's a particular diagnosis, ALL, haematology, whatever it might be, you can go in there and it'll be those parents that understand that particular diagnosis, they're with you, and you can ask questions, and usually they're responding. And it's a good way to, if you're worried about something, my child's wanting to eat this or doesn't want to eat this, put it up there, and I'm sure a parent's been through it, they'll answer your questions. We also have obviously the KCSG house, which most of you may have visited, but we bring together the parents, we'll do dad's events. Last week on the Bulldust and back, it's not only a fundraiser for us, but it's also about the dads getting together, spending that bit of time, getting back into, speaking to others, social, as you mentioned earlier on, being social, and other parents who get it, been there, so it's a great opportunity. We've got the wellbeing walks, so we do the HBF run, we'll do the up all night, some of the mums and dads get together. You want to go for a walk, you've spoken a lot about that, mental health, getting out and looking after yourself, so give us a shout and join one of the walk groups. Mums and caregivers events, we do several of those during the year. The Christmas Sundown is going to be coming up soon. And then families and kids events. We're just bringing back that community which you're part of, and that, like I say, it's now and ongoing for years down the line, it never ends. I know one of the big things that people worry about parents, especially children, they've been in that isolation for such a long time, and some of the behaviours, that they start to show due to the trauma, due to those procedures, confinement. And let's be honest, we'll just give them what we want, keep them happy through that time. So we've got the play group there, which is guided by Sally May, a professional play therapist who's here today. So feel free later on, have a chat with her. She's got a whole wealth of knowledge and experience, and she's available either face to face, phone, email, anything. If it's just to ask a question, my son's doing this, I'm desperate to stop, why, anything behavioural thing, anything like that, Sally's the go-to, and in case she cover all the costs for that for you, okay? She's a regular attendee at the playgroup, so if you want to go along and connect with other parents or grandparents there, and have a chat with her while the child is in a safe environment. As we say, that immune compromised situation, we make sure that everything is either brand new at the playgroup or clinically cleaned. It's all sterilised so you can feel safe. We know what it's like. You go in any other playgroup, you just walk around with your tuffy wipes wiping everything. That'll all be a safe place for you, okay? So feel free to attend that. It's a free playgroup and a great way to connect with other parents, but also the likes of Sally as well. And Kane, fantastic music guy as well. Music is great for the heart and soul, so he does a great job with the kids there as well. Okay. And that's it pretty much, but I try to keep it smooth for you.
Kids cancer support group.
Yes.
And also knowing that our family here at 30 in the morning, there are families who have terminal cancer, they do not have
Yes.
cancer diagnosis.
No. Yeah.
But they receive chemotherapy going into transplant. So they have
Yeah, as I mentioned at the beginning, I mean, the name Kids Cancer Support Group was inherited, and as a committee we're reluctant to just change that, I believe, but we do promote everywhere that is cancer and, oncology and haematology, and anyone who walks on a ward or an area that needs any kind of that treatment, we will give everything the same, there's no difference, okay, so we would definitely, that's it, alright?
Sarah is gleaming with happiness.
Thank you, Richard. And also just a big shout out to Kids Cancer Support Group for staffing the creche today, which made it possible for so thank you. Next up is Phoebe Chato from Cancer Hub. Welcome, Phoebe.
Hello everyone, like I said, my name is Phoebe. I am working as part of Cancer Hub. I'm a cancer navigator, and I'll go into a little bit of details what Cancer Hub is and the organisations that we have as part of us. But just wanted to kind of introduce the services to you. It does sound very cancer specific. There are a few services within Cancer Hub that aren't cancer specific and support families who are going through cancer-like treatments like transplants and chemotherapy, radiation as well. And I would like to apologise, this is going to be very fast because I'm talking about 4 organisations in this time, so I will be at the table afterwards if there's any more in-depth questions as well. So in a nutshell, Cancer Hub is a partnership between Camp Quality, Red Kite and Canteen. And this was formed in 2022, and it's just designed to be an ease of access for families, to be a single entry point for families wanting to go into those services, basically so they don't have to be referred to 3 different services when they need them all. We're primarily for young people 0 to 25 years of age who either have a diagnosis of cancer or cancer-like condition, or their parents have a diagnosis as well. So within the Cancer Hub, we've got specific services plus the services of the 3 organisations. So as part of that single entry point, we have a national intake. So if you are interested in supports, you get referred to our team. They just ask you some general questions about your circumstances, your experience, and kind of let you know about the services that we have and tailor that support for you. So you're not getting referred generically to services, you get a warm referral over so you know what's available for you. From there, I'll talk a little bit more about this in depth in the next slide, but we have a cancer navigation service. Again, using the term cancer, but this service is actually available for all families who are undergoing cancer or cancer-like treatments. And it's a specialist case management service that works in conjunction with either your health team or after you finish treatment as well. And for our 12 to 25-year-olds as well, that can be patients, it can be siblings, and it can be children of parent patients. We have an online counselling service that's available nationally as well. And I'll talk a bit more about that later. So the main service that has come out of Cancer Hub is our cancer navigation service. So this is part of my role. I'm one of 2 cancer navigators here in WA, and it's a specialist case management. So it's hard to kind of say what this looks like because it's very, very different for every family that comes through and sees us. But basic eligibility criteria is there's a young person, 0 to 25, who has a diagnosis. We get a lot of referrals through from hospitals or just referrals from families or other organisations, and some of the things that we can provide with are linking with other services, can be finding financial supports for you, practical supports for you. We do a lot of advocacy, so we can advocate to NDIS, to Centrelink if they'll allow us, support with any travel assistance, but it can just be general, like just someone that is there. And if you've got any general inquiries, you just want to speak to somebody or get any support, you get the number of your cancer navigator and you can call them, text them, email them, and we'll support you in whatever way we can. So it's very individualised. Primarily work with parents, but obviously young people, if they'd like to come through as well, we can provide that support with them directly. So one of the first organisations that I mentioned as part of us is Canteen. So Canteen is for young people who've been impacted by cancer or cancer-like conditions. So they'll provide support to young people with the diagnosis of cancer or who are undergoing those cancer-like treatments, have a parent's diagnosis, have a sibling's diagnosis, and we also help bereaved families as well. Primarily for that 12 to 25 year age bracket, but we are now supporting parents within this space as well. So this can be the challenges of navigating through that cancer-like journey and just supporting your kids with their emotions or managing your own emotions so you can best support your kids and strategies they can use with them as well. So Canteen services are counselling-based services is one of the bigger ones that we offer, and this is for the 12 to 25 age bracket. And this counselling can either be done online or it can be done in person. In Perth, we've got an office, which is near Crawford Lodge, near the Children's Hospital. We also have programs and events. So these are just a space for young people to connect with each other around their experiences, and they're just a little bit of fun for young people. This year we went to Adventure World, we did glow golf. It's just a very relaxed environment because we know that young people want to be around other people who get it, and so that's just why we offer those support services. We do also have some specialised services as well, so we have grief-related programs and more programs that are tailored more towards young people with a diagnosis as well. For the young people with a diagnosis, we also have an education and career support service. So this is for anybody that 12 to 25 age bracket. It's an appointment with a career consultant to kind of support them, look about what they might want to do when they go to high school or when they finish school, or if they want to do an apprenticeship, or they're not even really sure what they want to do. We've got some career consultants with us that they can be linked in with for that as well. We have a robot service, which sounds really, really fancy, but it's basically for young people with a diagnosis. We send a little iPad on wheels into the classroom, and basically it's just so young people can have a presence in the classroom while they're in hospital or while they're at home and are not able to make it into the school environment, just so they can keep seeing their friends. It doesn't even have to be for learning. It can just be they can sit around recess or lunch with their friends and have a bit of a chat to keep them connected. We do also have a few other things, but that's a lot for that right now. So the second organisation that we have as part of us is Red Kite. So Red Kite is cancer specific, but they support families with a young person 0 to 18 years of age has a cancer diagnosis. And their motto is they just want to be there for anybody who's impacted with that cancer diagnosis, and they can support the young person, obviously their parents, their siblings, but also extended family, grandparents, aunties, uncles, and friends as well. They have social workers as part of their organisation as well, so they work in that social work model of care and just want to make sure that they're just very mindful of everything that's happening and just want to be there to support you through that. The ways that Red Kite can support is the big one is they also have a counselling based service for them, but they are not 12 plus, they are from 0 to 18 years of age for the young person, but also, like I said, support siblings and parents as well. So counselling all across the board for those the families that are impacted by cancer. They also provide financial support. So they've got a few different tiers of financial support they provide for them. Most of the times that gets linked in at the hospital environment, but you can also pop through your own referrals for that if you didn't get linked in at that stage, or you're wanting to access any additional tiers of financial support. The other one is connection and wellbeing. So Red Kite also have a range of places to connect, support groups they have for parents, for grandparents. They also run groups for siblings and for the child as well with a diagnosis. And they also have their informal coffee catch-ups as well. So it's just a space for parents to go and connect with one another in an informal environment and just be around other parents who understand what they're going through. Camp Quality. So Camp Quality is another cancer specific organisation, but they support families where the young person 0 to 15 years of age has been impacted by cancer. So this doesn't have to be the child's diagnosis, this can be the parent has the diagnosis, and they also support bereaved families as well. But in a nutshell, they just want to bring smiles and positivity into the world of cancer, which is a very tough space, and they do this absolutely beautifully. They run lots and lots of different programs, so they've got family events where families can come together and have a really nice time and just have the kids socialise and be together. They also have experiences that they provide as well, so this might be tickets to things like the zoo or the cinemas, just a space for your family to come together and just bond throughout these journeys. They also have kid-specific camps as well, so a chance for just kids to come together in a very structured environment and just have a little bit of fun with that as well. They also do parenting-based support, so this is very similar to the canteen-based parenting support, but it's done by a family counsellor, and that's more for that 0 to 15 age bracket where the Camp Quality ages fall into as well. The other big one that they do, which you probably would have seen come around the ward, is they've got their puppets as well. So their puppets come around, they're an education-based program for young people. They can obviously go into the ward, but then they can go into schools as well. And it's just a way to educate kids on the experiences of cancer and cancer-like conditions, This is open to all families, so not just those with cancer diagnoses. And it's just a space for them to learn, but also for their peers to understand a little bit better as those kids integrate back into the school environment as well. That was a lot for everyone to take in. So I guess in a nutshell, this is probably one of the more important slides. So this is how to refer to us. And the reason I say that is because you don't really have to know what's available. You can refer through to Cancer Hub and we'll do all that navigation for you. So you can come and say, I don't know what I need, can you please tell me about the services? And we'll go through and tell you those services and refer you onto those services and whatever's going to work best for your family. This can be done by yourself, so we can go onto the website, you can pop your own details through and someone will reach out to you. Or a medical professional or an allied health professional can do that referral for you. So it's very easy through the website. There is also a number on there. You can give us a call if you've got any questions. But they're the services that we provide. As I said, any questions, any clarifications, I do have a stall out with the camp quality and the canteen staff, so please come and chat with me. But that is us. Thank you.
Any questions for Phoebe?
Nobody knows what to ask.
Thanks, Phoebe. Okay, and finally we have the Fiona Hunter Foundation. Welcome, Fiona.
Hello. Thank you. That one? Okay. Good afternoon, everyone. Now, I'm Dr. Fiona Betnat. By training, I'm a paediatric radiologist and emeritus at PCH. And most of my working life was, or a lot of my working life was dedicated towards the imaging of oncology patients. And I thought I had a fairly good understanding of that. But nothing prepared me for having a family member diagnosed with leukemia. My great nephew, Hunter, was diagnosed at the age of 3, had a 5-year journey of multiple cycles of chemotherapy, admissions for febrile neutropenia, he had bone marrow transplant and CAR-T, eventually succumbed to sepsis in September 2021. So I'm here not as a paediatric radiologist, but as a family member touched by cancer, Hunter's great auntie and a director of the Hero Hunter Foundation, which we set up in his memory. Now, Hunter had a close-knit family and a devoted family structure around him. Many people are not so lucky, but even then it was apparent to us that there were gaps in the existing services, and the foundation was set up specifically to see if we could address some of these needs. Just in terms of our eligibility, we offer support, practical support for all inpatients on 1A, be they haematology or oncology patients, and we provide outpatient service to anyone who's immunocompromised, be that as a result of their primary disease, as a result of chemotherapy, bone marrow transplant or CAR-T. So it's pretty obvious this morning that one of the major topics that are problematic for patients on the ward is food. And particularly at PCH, with the added security, people can't leave the ward and get back in, and you can't get food services delivered. So one of the things that we did very early on was to provide some food on the wards, and in partnership with U-Foods, we provide some nourishing meals that can be heated up in the microwave, and also some drinks. So it's one of the few things that you can do daily to raise people's spirits so that they're not hungry. And this is our major expenditure, about $20,000 per annum. One of the other things that we do, I'll advance my slides, here we go. If you've been sitting up all night in one of the hospital chairs or something, you've got a crick neck, we are able to provide some remedial massage just to provide a little bit of support and care for our parents. As we noted, the last thing on your mind if you have a newly diagnosed child with cancer is house cleaning. So we provide a cleaning service for all newly diagnosed patients with with cancer so that you can bring it home. You don't have to worry about your housework and you can bring your child home to a reasonably clean environment. And for any families who require bone marrow transplant or CAR-T, we provide an extra $1,000 per annum for a really deep cleaning service so that the houses can be really very well cleaned, and a further 6 months of cleaning while the children recover from their transplants. So also we noticed, you're not thinking really, oops, I'm going to go back there, we're not really thinking about keeping the garden tidy, and so with our volunteers and our corporate groups, we provide a volunteer garden makeover, busy bees, home maintenance and repairs, and that's very good for working with the community. We live close to PCH and we could provide some support for drop-offs and pick-ups around the hospital, but many families are not as lucky, and it's a terrible thing that in addition to having a child with who's sick, you're financially disadvantaged by the cost of parking and petrol. I wish we could say that we've done well on advancing parking support, but we haven't. But we are able to provide some vouchers, and we've donated over $16,000 worth of petrol vouchers in the last 12 months. So as part of our education services, and partnered with Red Kite, we provide a wonderful book called Hero Hunter and the Wonky White Cells. It's beautifully illustrated and age-appropriate text, and I'm justifiably proud of it because it's written by my daughter, Dr. Fiona Stanley, and we have 3 copies available to anyone who'd like to look at that. We also do partner with Camp Quality to offer some joyous experiences with a fishing charter once a year off Carnac Island. So all of this takes time and money, and I'd like to acknowledge Kate, who works tirelessly for this foundation so that your journey might be a little easier than her family's journey was. We've had over 30 newly diagnosed families just sign up for some of these services in the last 3 months, so it's clear to see how needed they are. We're funded, of course, by personal donations, grants and fundraising activities, and I just should note a few of them. The Westfield Whitfield Local Hero, which Kate's won 2 years in a row, supports our youth-foods. We have WA Charity Direct, who helps out with petrol and fuel vouchers. Variety helps us out with the printing of the book, and various other corporate groups that I don't have time to mention. But thank you very much for the opportunity just to discuss some of the very practical things that can be done to support our families.
Any questions for Fiona?
You mentioned about the cleaning, you mentioned about a lot of support, vouchers, parking. Some of our families here are more than 6 months post-transplant. Are they still be able to go to your foundation to seek this help? I'm asking you, especially at $1,000, I think it's quite an important
Shani,
for the families.
at present, we're a small organisation.
Yeah.
We have the $1,000 for that 1 year after
For 1 year?
transplant.
1 year after transplant?
Yeah.
Okay, good.
Yeah.
There you go. Quickly go and get it.
Well, that rounds off the presentations from the community partners.
Yeah, I just want to ask something from the community partners, which I will approach later on, because I've been talking to one of our social worker, Rob, and unfortunately Rob is not here. He was really keen to come for this meeting. I know we got lunch waiting there, but I can't see the adults yet, so I'm going to let you guys go quickly grab that lunch before they grab the lunch. I got Robin here. What we thought of doing is like getting all the brochures from all these community speakers, packing them up, and after 6 to 12 months post-transplant, we're going to give to our family. We refer to the social worker, and get to the family, and give this back to the family as a not finished transplant, but out of the acute phase, going back to the community, these are the support that we have, because we don't have that before. And you're right, some of us don't even know what's out there for our families, and this is a good topic. Go for it, Vasan.
I guess it was really, I think even for me as one
Yeah.
of the members of the team, it was interesting to hear a lot about this support in the community that is available.
Yeah.
And I know there are constraints, but how much of this is available to families that are regional or rural as well?
Okay, same, about the same.
So,
Absolutely,
so
everything's
there is
same.
the ability to do the same even outside of metropolitan Perth.
And with regard to play therapy, we do Zoom sessions as well, and we support parents to support their kids. We do some educational advocacy as well, so the play therapists can work with the school to assist.
Can I say, like, I think it's really important that when we started out, we didn't know anything about this stuff. So I think it's good to have it beforehand.
Yeah.
Can I just say that? We didn't use any of like kids can support,
Yeah.
but like we never got to use it or anything. So we're like 2 years post now. So
Yeah.
I think knowing this information prior to going to transplant would be massive.
Massive.
I know we
Okay.
missed a lot of families with COVID.
It's a learning thing for me.
And that's why we have this workshop. That's why last year,
Yeah,
in
but I know that
October-
there's like families that have the potential to be going into transplant.
Yeah.
That I reckon they would be sitting here, they would
Okay.
gain more than what we are right now because we've already gone through
Yeah.
and we've missed those opportunities.
Yeah.
Yeah, I just
Okay,
think
that's a good feedback. Robin, you're taking all those notes?
Yes.
Yep. Yeah. We were worried that in a pre-transplant setting will be information overload for the family. You know, they're already going through lots of counseling session. I'm not sure whether they'll be able to take on board. They probably put the pack aside, but you're right. Maybe.
yeah, like you give us the information of transplant and you look through it and you're like, our lives are
Yeah.
and I remember highlighting it and I'm going to ask this question.
Yeah.
And then obviously we got a little bit delayed and I was like, I'm not asking those questions, it'll be if it happens.
Okay.
I'll ask the question. If that happens there, like, I know we have the social workers. That
I
was
feel like
hopeless
this
and I
is
feel
more
like
references within our booklet
Yeah.
when we
Yeah.
first came to you.
Yeah, I think that's a good feedback.
we were in the mix, we were stuck in COVID time, but like it was, and that was made it very hard, but I just think that having that prior
Yeah.
of the supports
Yeah.
would be good, as well as having all the information on what transplant rooms as well.
Okay, that's a good feedback. Thank you. And that's what we're going to improve in future, trying to get some of the links and support stuff in the booklet, and not just this is transplant, this is the side effects and all that. And we're also mindful of information overload, but you're right. I mean, if it's in the booklet, anytime the family can go back there after the
Yeah,
transplant and
so
look at it. Yeah.
I've obviously touched base with parents that are going, potential to go into transplant
Yeah.
in the play group and everything like that, and they're very deer in the headlights about everything as well, and you try to do it as gentle as possible to explain
Yeah.
it
Yeah.
without scaring, because
Yeah.
everyone's different. And I just think having that, all this information prior, knowing that that's there, then I think that would be better.
Okay, all right, thank you. All right, taking notes? Yeah. All right, thank you. Thank you, everybody. So, thank you, Jen, our program manager, who did all the work behind the scenes. So we break for lunch, quickly grab, I don't think there's many adults there. Now, we are not going to come back here to take all your belongings. We're going to go back to G1. The parents will all go back to G1, the staff, everybody, for the afternoon session. That's aspirations for the future. And for the adolescent group, Frank, Kyra, Joe, just look, you're here. Your session will be just in the room next door, G7 away.